I would say the average age for perimenopause is age 45 to 50, but there are some exceptions.
Introducing the Perimenopause Bliss Podcast, a show dedicated to unraveling the mysteries of achieving optimal health naturally as you transition into perimenopause and menopause. Get ready to join your host, Dr. Seth Yates, an experienced naturopathic doctor, acupuncturist, and kinesiologist, as he shares his wealth of knowledge acquired from over 40,000 patient visits and 15 years in working with perimenopausal females. Welcome to the Perimenopause Bliss Podcast.
Hey, this is Doc Yates. Welcome to the Perimenopause Bliss Podcast, brought to you by PerimenopauseBliss.com. And today I want to talk about 5 things to consider that can lead to early perimenopause. As I had mentioned, average age for perimenopause, age 45 to 50, and that definitely corresponds with what I see in practice every day. But there's the exception. Yesterday I saw someone who is almost 40 and clear textbook signs of perimenopause. And I would not be lying if I'd said that was not the first time I've seen that. So today I want to discuss 5 things that can put you into perimenopause early that you should be aware of. So if you're in your late 30s and you're listening to this, take note and see if there's anything that could qualify you for this to get tested or checked out or start treatment early. Number 1, the most obvious, is a hysterectomy. So if you've had a hysterectomy, now if you've had the ovaries and uterus and everything, which is called a full hysterectomy, so a full hysterectomy means that they remove the ovaries and the uterus. A partial means that they remove the uterus but they leave the ovaries. Now, most of the time, people are told, well, you don't have to worry so much because we left the ovaries, so everything will stay the same from hormones. That is not entirely true. So if everything's removed, yeah, you're instantly in menopause. Like you pretty much just bypassed perimenopause. You went right to menopause. Now, if that's not the case and you have your ovaries, here's what happens. Sometimes you have to keep in mind that the ovaries get a percentage of their blood that came from an artery that came from the uterus. And that percentage varies in people, but it can be up to a third. So the ovaries can all of a sudden get a drastic cut in their blood supply. And I've seen many times where people have a partial hysterectomy, so they still have their ovaries, but all of a sudden they instantly start signs of perimenopause. The second thing would be is that if you didn't have a hysterectomy, but say you had an ovary removed. This is common if you had a lot of ovarian cysts or an ovarian cyst rupture or damage to the ovary, and then they've had to remove that one ovary. And even though you still have one ovary, you're only working on half capacity, and it can't always basically pick up for everything that it needs to do. So if you've had one ovary removed, it's more likely that you could go into an early perimenopause. A third sign, keeping in mind that the majority of symptoms that I see of perimenopause are related to low progesterone. Another health concern that is linked with low progesterone is fertility issues. So if you have a history of a lot of difficulty getting pregnant or maintaining pregnancy and it's related to low progesterone, it's almost like you're kind of on that process already of going into perimenopause. So you might be a little bit more wary to watch out for signs and symptoms. You know what? And I'll discuss some of those signs and symptoms at the end. The fourth thing that can put people into early perimenopause, chemotherapy and certain drugs. So there's a lot of times people finish chemotherapy or radiation and it's just basically put them often directly into menopause, let alone perimenopause. But those drugs can have a big effect on your ovaries and on your hormones. And if you've been through that, then make sure that you're getting your hormones checked and monitored. And number 5, the thing to consider for early perimenopause is your mama. If your mom, it's very common that I find that if your mom went into early perimenopause, chances are of you going into early perimenopause is increased. It's not 100%, but it's pretty consistent. So anytime I have seen someone who's gone into early perimenopause, almost always their mom had also gone into early perimenopause. So ask your mom, How old were you when you started getting signs of menopause and perimenopause? And keep that in the back of your head so you remember. Now, what are some of these signs and symptoms that you'd be looking for? Changes in your cycle. It could be getting shorter. It could be getting heavier. You could be getting more increased PMS. And again, typically age 45 to 50, but if you're, I would say anywhere from late 30s, just something to be aware of. Changes in your sleep, so disturbed sleep. Now, if you've always been a crappy sleeper and you've always been a light sleeper, this is probably not what we're talking about. I'm talking about changes where it's like, oh, I used to sleep fine, or maybe I had some problems falling asleep, but now the issue is I can't stay asleep. And if that change is starting to happen, that's something to be aware of. It's one of the main symptoms I see for perimenopause. And weight gain is a big one. But there's weight gain, a lot of times people gain weight, they like to blame it on hormones and thyroid, and a lot of times it is related, but we're talking about weight gain where nothing else has changed. Because a lot of times when I question people, I'm like, okay, you've gained, let's say 15 pounds in the last 3 months. What's different? They're like, oh, well, I used to have a more active job, and now I have a desk job. Or, oh, I was going to the gym, but now I stopped going to the gym because I injured my knee. Or what would be another? Changes in medication, that's a big one. So you don't want to put all of your eggs in one basket. I guess that's not a menopause joke. That's just coincidence. But you do want to look at each of those symptoms, the sleep, the weight, the mood, the cycle, and just kind of keep those always. You don't want to obsess about it, but you want to make sure that you're kind of keeping track in the back of your head, just so you always have an idea what's going on within your own body. So I hope this information was helpful about the 5 things to consider that can cause or lead into early perimenopause. This is Doc Yates signing off.
Thank you for tuning in to the Perimenopause podcast. Don't forget to hit the subscribe button and visit perimenopause.com for more valuable information on how you can thrive during your transition through perimenopause. Join our community of like-minded women who are dedicated to achieving optimal health naturally, and stay up to date with the latest tips, tricks, and advice from Dr. Seth Yates. And we'll catch you on the next episode of the Perimenopause podcast.